especially infants and toddlers, have a habit of putting things into their mouth, and some objects can cause children to choke. So as scary as this can be, there are some precautions that parents can take to minimize the risk of choking. So tell me, Dr. Rama, what are some of the common causes of choking?
Choking is something we come across quite often in the emergency department, and sometimes it can be quite disastrous as well. The main risk factors for choking is, number one risk factor is the age. In children who are younger than 3 to 4 years of age, they are at high risk of choking because they're trying to experiment on a daily basis with their hands and mouth, and their way of exploring the world is through their mouth. So they put things into their mouth. So young age is the biggest risk factor. So children less than 3 to 4 years, we have to watch closely what goes into their mouth and be a little bit alert to a possible choking episode. The other risk factors is the type of food that goes into them. So if they have food like nuts in a young child, that can be quite disastrous. We do encourage giving nut products, but not whole nuts in children less than 4 years of age for the same risk of choking. The other risk factor is multitasking. While we all think we can multitask, especially for children, it doesn't go very well at all. If they're talking, if they're running, walking, or playing, laughing, then that is a big risk factor for choking as well. So just make sure that when they have some solid things in their hands, like lumpy things, they're not multitasking. The other risk factor is having a respiratory tract infection. So when you have respiratory tract infection, you have lots of secretions that actually impedes the protective reflexes, and they're at a little bit increased risk of choking when you have an infection. That actually makes our life difficult as well, because we don't know if the cough is because they potentially choked on an object, or is it actually from the respiratory illness or the common cold. So those are the common things that seem to trigger choking in kids.
So what are the usual things that children are choking on?
Most of the times it's the food material. So the young age kids, especially those less than 3 to 4 years, they're mainly choking on the food that they are eating. Some of the things that might look very simple is the whole grapes. So they're actually very dangerous because of their size, they can cause complete obstruction where their airway is completely closed off. So we always advise that cut the grape into half in children less than 3 years of age. That is really important. The other things are
nuts, you mentioned as well.
Nuts are a big thing as well that they choke on. And in little bit older kids, which we do see in about 20% of the time, it's the toys. So there is a regulation actually for kids less than 3 years of age. Anything that they could potentially choke should not be in the access of them, especially those small Lego pieces that we see at home. We should be very careful about. Older age kids particularly are at risk of choking, and anything that is small can be choked on. We had a teenager recently who choked on the thumbtack.
So a thumbtack?
Yes. Which was lucky enough, it went in such a position that the tip was pointing upwards and we could easily retract it.
Teenagers.
And we had another kid who was biting on the back of the pen, where you have the lid, and she was laughing at the same time, and it got dislodged into the airway. So things that we think are very simple, just to be aware of and prevent. And if it does happen, it's very important to know what to do.
So what should we do?
So most important thing is, as a person next to the person who is potentially choking, take a big breath, calm down yourself and see what can I do to help. And the next thing is to see if there is complete obstruction or the obstruction is partial. If it's a complete obstruction, the person actually cannot talk, don't have a voice, and they might actually even collapse. Those are the times we should act immediately and try to dislodge that foreign body. There are number of things we can do, and the most important thing is to give some back blows. So if it is a small child, put the child with head down and front of the body of the child downwards on your lap, and give 5 back blows between the shoulder blades. That usually tends to dislodge, and turn the baby to the normal position again and check if something has come into the mouth. In that case, sweep and get rid of it. If that doesn't work, turn the child to the normal position and give chest thrusts. So initially you give 5 good back blows with the heel of the hand. If that doesn't work, give 5 chest thrusts in the child lying on the back. So that usually works. If it's a little bit older child, when you can hold, keep the child slightly upright but leaning forward, and then make a big fist just above their belly button, and you have the other hand over it and give big thrust so that dislodges the foreign body. This is for those with complete obstruction, and this is amazing. You could potentially save a life. But if the child has not got complete obstruction, then you can just encourage the child to just cough and clear. If they have coughed and cleared, that's fine, you don't have to do anything. But if they're still having ongoing symptoms, or you're pretty sure they would have choked, which you can come to know if there was noisy breathing like stridor, or if they're struggling to breathe, or there's a wheeze, or there's a little bit of fast breathing or sucking in, then time to go to the hospital or your nearest GP, get a chest x-ray, get the doctor to have a listen. And most of the times when there is suspected foreign body, the main way of diagnosing is having a good look and getting rid of it.
So there you have it. It's scary though, seeing a baby or
yeah.
child. I think every parent will see their child choke even just for a second on something, and they go red and their eyes are watering. But it's such a horrible thing to watch.
The good thing is we have cough as a protective reflex, and most of the times you've just touched your area and they've coughed it up and they're perfectly fine. Just a little cough is fine. But if they are coughing persistently, then having a noisy breathing, then you know that they could have potentially choked and need to get attention. But quite often a little bit of choke and gag happens most of the times when they're eating, and they're
especially
all fine.
If you've cooked something bad. No.
Yeah, all mothers are good cooks when it comes to their kids, isn't it?
Absolutely. So there you have it. If get some first aid training, should this situation ever arise, you know what to do. So if your GP is ever wanting to refer your child to a paediatrician, though, certainly ask them to refer you to the amazing team at Townsville Paediatrics. They have a team of specialised paediatricians with a huge range of specialty areas, so your child will be in very good hands.